I was shaken by my father when I was 4 months old. I was rushed to the hospital and my family was told that if I had arrived even a few minutes later, I wouldn't have survived.
She said that she shook him on more than one occasion and that she slammed him down. And after you hear the news that somebody hurt your child, like nothing else really matters.
It's difficult to imagine what a parent must be feeling when they see their child lying in a hospital bed knowing that their child was abused and is a victim of shaken baby syndrome.
Just to see that tube down his throat that was breathing for him was the hardest thing to see.
They discovered that she had 3 subdural bleeds. She had 2 bilateral temporal, which are the sides of her brain, 1 frontal, and 1 in her occipital, which is the back. She also had a retinal hemorrhage, a bucket handle fracture in her long bone in her leg, and she also had 5 broken ribs.
The neurologist pretty quickly showed us brain scans and just explained that what spots of her brain were gone, died, and that they would never come back, and that she was going to be severely disabled.
When Deacon was injured, he ended up getting life-flighted once he was taken to the hospital to a more major medical center where a large portion of his cranium was removed to relieve swelling. A large portion of his skull was absent and it was just skin covering
brain tissue.
Families' lives are forever changed by shaken baby syndrome. They're left with trying to figure out a new normal, from day-to-day care to what the future holds.
It's really difficult to look at your child and not know, is that something that's wrong? Is that something I need to look deeper into? Is this because of what happened, or is this just who they are? I don't want to feel like I'm trying to find things wrong with her, but I don't want to miss something wrong with her.
She's catheterized, and she has a colostomy, and she has a feeding tube, so she can't do anything. Kind of like caring for a 6-month-old baby is how I explain it sometimes.
I shouldn't be sitting in this wheelchair. I shouldn't have had to struggle to learn how to eat. I shouldn't have a catheter stuck inside me. I should be a normal 41-year-old woman, driving, doing the things that 41-year-olds do.
He has some words. He can say, mommy, but a lot of times it's mainly utterances. So I'd say that his main challenge is communication.
Can you say cake? Cake?